Finding Hope, the Road to Recovery.
Hi everyone, my name is Jasmine Hernandez. I am a community liaison at Tarzana Treatment Centers, and today we will be discussing the topic of foster youth and integrated healthcare. With me today, I have my colleague. Would you like to introduce yourself?
Hi, my name is Karizma, and I am the community liaison for Tarzana Treatment Center in the Antelope Valley.
Thank you, Karizma. Like I said, we'll be discussing integrated healthcare and foster youth. Karizma is here with us today so that we can discuss her journey through the foster youth system. Now, Karizma, if you don't mind, can you share a little bit about your journey through the system and how it shaped who you are today?
Yes, I can say I've been in the foster care system maybe since I was 3, and I was raised by my grandmother, which is you're still a foster kid, but you are with a family member. Mm-hmm. And that's just defined as not being with your regular parents. The journey was kind of tough, not really knowing who my parents were, but not where they were. So that was kind of something that I dealt with all the time. And I kind of carried that along all the way through to my adulthood and through my marriage.
Right. Thank you for sharing that. And on that note, how would you say that it impacted your views on family or your close relationships now as an adult?
Okay, so with families, I would say, because I have my own kids, I'm like I hover over them. They're super sheltered. I try to really kind of control everything to where they are, who they're with, what they're doing, kind of really just knowing where they are and what's going on with them for the most part, and which my son absolutely does not love. But our relationship is real strong, and it kind of molded the kind of parent that I am, because I want them to be able to talk to me about anything, whenever, however they're feeling. And as far as my marriage, I would say my close relationship would be, I deal with abandonment really bad because I did not have my parents. When my husband gets upset about something, right away I'm like, oh, he's gonna leave. Right, even though that's not the fact, but that's exactly how I feel. Back to my self-worth. My parents didn't want me, so he's gonna be upset about how I am, and he won't be accepting of me, if I really tell him how I feel.
Right.
But I had to learn how to work through that. And even though we've been married for 18 years, I still deal with it today.
How did you learn to work through that? Did you have mentors? Did you seek counseling?
I did go to counseling. After my husband's deployment overseas to Iraq, I did go to counseling to understand where he was coming from, how he was feeling, and how he was dealing with things. Because really, I was really focused on myself and saying, well, he's upset, it's because of me.
Right.
And was not the case. I did not realize everything that he went through overseas, and then he comes back home and now it's back to regular life, not really having the time to, disclose and download what was going on overseas. So my counselor did help me and, let me know about my challenges. Like, one of the things they told me is I overshare, right? I overshare because I'm trying to explain why I am the way that I am, why I am the way that I am. So, but it was good. I did like the counseling. I did have mentors growing up. I pledged a sorority called Tau Eta Delta, and it was for the youth. And I had a big sister, and she was about 25, 26, and she was able to, help me with my emotions. Why you never cry? Why you never break down? Why you're always so tough and so stern? But I thought I had to be like that because for my grandmother and for my, for my grandparents, and, kind of save face for everything.
Is that when you learned how to be vulnerable and maybe picked up that oversharing habit?
Absolutely. Absolutely. And that I don't always have to feel empty spaces with words.
Okay.
I can sit there and be quiet and just be in the moment, not just, rambling on and on kind of thing.
As a foster youth, was it the opposite before you joined that sorority?
Oh my goodness, it was. I was kind of isolated. I didn't put myself out there too much because I didn't want to be ridiculed or rejected. By the time I got to high school, the school I went to, I had to apply there. So most of the kids I went to school with, elementary, junior, they were not there. So I was able to, be my own person, but also I separated myself because I didn't want them to know I got a little old lady at home, like, I don't have parents kind of thing.
Okay.
So.
How would you say that foster youth are typically viewed at school or, say, in their community?
Ooh, That's a good one. I would say that they're more, I mean, as far as I was concerned, we're like problem children, or you got to watch that one. And that for me, that was because I would have a lot of events that I would go to, but because my grandmother couldn't sit on the bleachers, right? If I'm playing a sport, she couldn't, she's too old, she's older, her back is not built like that. So I would be at these events and I would be by myself, right? And then a lot of the time, other parents would take some responsibility for me because they're like, oh, she doesn't have anybody. And it's not that I don't have anybody, I do have a whole support system, they just can't be there. But yeah, sometimes they're viewed as a problem because there's nobody to hold them accountable, which is not true. They're probably not there at the time. But, and then also you can think about some people, because of the economy and how things are, they get foster youth for money. And then they're not really doing their due diligence for them because they're trying to survive themselves. So sometimes that leaves a foster kid out to kind of look out for themselves or make things happen for themselves. Talk to other people. That's why it's important to have a resource system, what do you call it?
A support system.
A support system.
Reaching out to your resources.
Absolutely.
Which we'll talk about in part 2.
Right.
Which will be important. How would you say that those challenges affect the mental health of foster youth?
I would say it absolutely affects them. Even in school, sometimes the kid is at school and so they're acting up, what we might perceive as the kid acting up. But instead of saying, what's wrong with you? Like, why are you doing that? Just say, what happened? Like, why do you feel like you have to respond that way? And, have some compassion because they're going through a lot themselves, especially when you're taken out of your home and you're in the same city where you live and where you lived, with your parents, but now you're living somewhere else where you can't go back to your parents' house. So then sometimes that puts the kid in a situation where they're like, well, I know I'm not supposed to be here, but I love my mom. Regardless why I was taken away, I want to go home. I want to go where things are familiar. I want to go where I'm comfortable. I had a niece that was in foster care, and she went back into foster care with her because of her own choosing with what she was doing, and she was like, Auntie, they don't understand my hair, and that was a big thing because as African American female, we have things going on with our hair, right? It's important for us to have braids and protective styles and stuff like that. So that was something that we had to. We got a special caseworker to help us to express that to her foster mom. And it also opened up an avenue for me and my niece to reconnect because we were kind of estranged. Teenage years are hard. They're hard. They were hard for me. And I'm sure they're hard for her. But I mean, it was a way for us to be able to talk about things again and where I can express that I absolutely do love her. But, you have to have... you have to be accountable for what you do and responsible for what you say. You can't just say and do anything just because you're upset. So, yeah.
On that note, with you, letting her know that you have to be accountable, you can't say or do things because you're upset. Do you have any messages that you would want to share with foster youth? Absolutely.
I would just say, that there is help. Right? Like we work for Tarzana Treatment Center. Part of the reason why I work there, I love helping people. And I love being a voice for those who don't have a voice. So, reach out to your resources. If you don't know anybody, we have this video, Tarzana Treatment Center. To have somebody to talk to, even if it's just to help you decipher your emotions and how you feel, especially in high school. Right? They get into relationships and they're so serious and then they're going to go away to college or wherever, life is going to take them when they graduate and turn 18. But it's good to have somebody to talk to, a support system, and that you're important and you're valuable and you're worth the time.
Is there any type of support that you felt you were missing at the time, like mental health resources or any type of health resources?
Absolutely. See, we went to church. Right. So that is a resource. But then there's also the clinical side of that. Right. I needed somebody to tell me that I was okay and that I was normal and that I was not weird, because I did feel absolutely so weird from all the other kids, even though I didn't know who else were foster kids. But I did feel like an outcast. Right. So, it's just important to find somebody to talk to. Even if it's a teacher, because everybody has a favorite teacher, right? A teacher, a school counselor, or, like our services that we have to offer at Tarzana.
Yeah, definitely. Those mentors and advocates are so important.
Yes, they are.
Did your niece have that?
Yes.
You mentioned the cultural sensitivity.
Yes, I did. When she was with me, we did do counseling and all that. When she went to the other care, there was nothing I can do. But I did tell my niece she could always call me, and that would never deny her, even though we were kind of a little bit estranged after the way that we separated. But I always told her that I was her aunt and that I loved her, and whatever I could do, I would love to help her. So, and I seen her around, working. That's the awesome thing about this job. It was like full circle. I went to a event, and she was there. Oh. And her friends were there, and we had an awesome time, on our work time, tabling, and it was awesome. She got to understand what I do. So,
right. Yeah. That's amazing. Yeah. That's really rewarding. You've shared a little bit about what you do with Tarzana Treatment Centers. Why don't you share a little bit more about other goals you might be working towards and your vision for the future just for yourself?
For the future, okay, so I do own a small business. And I love it. Right now I'm focusing on broadening my horizons. I'm not just doing my website, but moving forth with the other apps. But I hope to let this be a legacy that I can give to my children, hand down to them. My son's getting ready to go to college, and I'm encouraging him, about entrepreneurship and working not-for-profit, because there's such a need, and there's so much that we can do. He has his own challenges as well. Right, so he can use that and catapult it into his future. So, but I encourage them to. I take them when I do events. I take them with me to work, and they hate it sometimes, but I love it that we get to work together. Tearing down the sets and putting them up and taking them down. So it's really good, but it's rewarding, and I love working for Tarzana. I like having my little side hustle, and and being able to include my kids and put a little money in their pockets, and getting to see their mommy work, and a different, not being at home.
Right. Is there anything that you would like to add about your healing journey? Because it seems like you've really come a long way, and it's incredible to hear.
I would just say, really get the help. It's there, it's available, and it necessarily doesn't cost you money out of your pocket. And there's so many things that we have in our area. These events, just expand your horizons. Just because things are not perfect at home doesn't mean that you're not going to be okay. You will be okay. It's just a matter of finding your niche into things. And like I said, going to somewhere like Tarzana that has a fully integrated healthcare organization where they help the whole person. And that's so important. It's really important.
Yeah. That's wonderful. Thank you so much for sharing that. And I really appreciate you being vulnerable. So Karizma, what do you think are some specific things that foster youth face in, say, a school setting?
School setting, I would say one would be helping with the work to be done, right? Mm-hmm. Because not everybody that you could be placed with might not be a rocket science, right? You may not know how to do all the math or English or whatever it is. I would say would be tutoring, getting help with their work at school, mm-hmm. Rides back and forth. There is it's kind of like Uber, can I say that on here? It's kind of like Uber, and it transfers to youth only, back and forth to school, which is a safe way for them to get there. Because if you get a safe way for them to get there, they'll stay. Mm-hmm. Also, being involved in something, a debate team, playing a sport, being a part of a group that they have at the school. Being involved at school is important because it keeps them at school and keeps them motivated and moving forward. And then they have these activities that they can work towards. Mm-hmm. Start one way and then finish another way. See their accomplishments. I feel like that's something that our youth really need, and something that they can focus on. Just pour yourself into school. Mm-hmm. Some other challenges would be behavioral, because emotional. We go through so much at home or at the foster care, wherever you live. They go through so much. It's just emotional. Having somebody to talk to is really important. And I always tell the person that answers the phone in the front desk, and I always tell them how much I appreciate them and how wonderful they are, because that they are the first line of defense. When something happens, they're the first person that's contacted, and their actions are so important. And so it's including the security. I love the security at my kids' school, because they give them like, the little pound it with their hands, or they have like a little hand thing that they do. And it was different for like 7 kids. And I was like, this person is awesome that they know all these, little, hand gestures that they do. And it helps the kid feel loved and that you care about them. No, they're not bringing them stuff, to eat and taking, picking up their Uber food and bringing it over or anything, but they're just giving them that time and attention. And that's one of the things that a lot of our foster kids can lack. Just because they're in a foreign place or a different home with people that they don't know. I'm sure it's tough the first month or so, just getting acclimated with their schedule and how they do things and just following directions.
Right. And then you mentioned the security, like finding those new trusted adults. I'm sure having another person that's an adult in their life that they can trust is huge. You also mentioned just being involved in activities and sports and recreational activities, and that keeps them busy, say after school, instead of getting involved with other things. Were you involved? You mentioned your sorority. Were there any other activities that you were a part of?
The sorority was part of the church, right? So we were big churchgoers. I did play sports, softball, volleyball, basketball. When I moved to San Bernardino County, I got involved in snowboarding. When I was in elementary, I swam competitively. Oh, okay. So that took a lot of my energy. I was really tired. Those having swim meets on the weekends, it kept me busy. Award ceremonies and all that. And, and I wanted those awards. I wanted those blue ribbons, right? So, it was a struggle when I was in elementary in that swim team because, man, I was so young and I didn't understand and I had a hard time trusting adults as well because I'm like, are you going to be here today and you're going to be gone tomorrow? That was kind of like how I felt about it. But my coaches really spent time with me. After we had practice, they would tell me good job, even though I was not doing a good job, that I was slow, but they encouraged me anyways. And, after a couple years, and I can even say now I love to swim. It's so relaxing. It gives me a way to burn off some energy and, decompress.
That's awesome. Do you have any other coping skills that you have found useful throughout the years?
I would say I like to organize things. I like everything to have a space. Now, does it all have a space in my house right now? No, it doesn't. But when I get overwhelmed or I'm upset, I do clean. Laundry is like the best thing because you get to from dirty to clean and wet to dry and then to fold. Just the transition. I do like that, and that does help me. It gives me time to think. And writing a journal is like one of the best things that you can do because you can track your goals. You can see where you were to where you are now. Short term, long term, and then just working towards them because you could have never told me that I would have a business. Before. I was so scatterbrained, especially when my kids were smaller. But as they got older and I had the time once they got into school, I was able to, move forward and kind of like try to organize my life, but also give me purpose because you do have purpose in being a parent. It is a full-time job when you are at home. It is a full-time job, but just having that time to yourself and then to create something else on top of being there for your children, it's an awesome thing.
And these coping skills, say with the journaling, is that something you picked up as an adult or was it when you were younger?
Well, they told me when I was younger. They told Write it down, right? They were telling me, but I was not I was like, that's like homework. Like I don't want to do that. So maybe in college, I was having all these crazy feelings, right? And I did go to start college early, so I did. I wrote down things, tracked what I was doing, how I was doing it. I did work out like crazy because I was filling up my time with gym time. It worked out for me then, but and having a routine. Having a routine is really helpful. But yeah, journaling, I didn't start doing that until I was about in college. And then really when things get tough, like when everything is good, I don't want to write. Right. But when things are not so good, then I'm going to write down my feelings and I can write all that stuff that I shouldn't say. Right. Yeah. And help me to get it out, really.
Well, it sounds like it's been very helpful. You're at where you're at now. You've come a long way. You've are an amazing community liaison, and you have your side business. And like I said, you've come a long way, and I'm really grateful that you shared your story with us today.
Thank you.
And I'm very grateful for the viewers watching today as well. If you have any additional questions, or please drop them in the comments. We may do an additional part where Karizma can share even more of her story. Karizma, do you have anything to add?
Not much. I just want to say, just for the youth, love who you are, right? Sometimes things are not always so good, but when you get older, you'll be able to look back and say, it wasn't that bad, right? If you had somebody that you could talk to help you decipher your emotions. And then also to give your foster parents a chance, because it's tough for them as well. It's really tough when you're getting a child in your home and you don't really know where they are. Right, you know what they've been through, but you don't know where they are. And foster parents, give the kids a chance. Bringing them into your home is a big thing, but also make sure that they have the resources that they need so that they can grow and develop the way that they need to. These centers like Tarzana Treatment Centers, they have all kinds of things. Behavioral health, mental health, prevention. There's so many checks, boxes that you can check off. Even if you don't know, just go and try and just see. And then sometimes, the counselor you get the first time might not be a good fit. Keep trying and don't give up. Youth don't give up on your foster parents, and foster parents don't give up on your youth.
Amazing. Thank you so much, Karizma, and thank you everybody for watching.
All right. Thank you for having me. Hi, my name is Karizma Davis. I'm a community liaison for Tarzana Treatment Center in the Antelope Valley. I'm here with Jasmine Hernandez. Is that right?
Yes, that is right.
And we're here to talk about integrated healthcare. So how are you doing today, Jasmine?
I am doing great. I'm happy to be here.
Great.
Good to be with you again.
Yes. So I wanted to talk a little bit about the integrated healthcare. And for those who are watching, can you explain what that means?
So integrative healthcare at Tarzana Treatment Centers basically means that we take a holistic approach, which means that we treat the whole person. We start wherever you're at, wherever you need treatment the most, or wherever you're comfortable with. We meet the person, like I said, where they're at. So if someone's not ready to go into, say, inpatient substance use treatment, we're going to start at primary care treatment. We have primary medical care. It's kind of a foot in the door approach where someone might go get doctor services, get used to Tarzana Treatment Center staff, and maybe there they might take a questionnaire that reveals that they have depression. So then we go ahead and refer them over to our outpatient services. Now that doesn't mean that you're going to be inpatient and you have to go stay somewhere just because you're depressed. A lot of people have that stigma, and that's not what it means. It means that you're going to go and see an individual therapist, and you're going to have an individualized treatment plan. So you might go 3 times a week, 3 hours a day, and you might be in groups, and you'll have your therapist. Maybe you'll see a psychiatrist, get some medication, and then maybe while you're in that program, then it's revealed that you're drinking a lot. And then if that happens, we do have our substance use disorder programs where if you're drinking too much, you can't just stop drinking on your own. And in that case, then we do have inpatient detoxification programs. So that's somewhere where we have a facility where you would go, you'd stay, you're monitored by healthcare professionals to make sure that you're able to detox everything out of your system in a safe manner. And from there we have a residential program. The amount of time that you stay really depends on what you're going through, how your program is going, what your case managers say, what your therapist says. It's all individualized, and that's because we take that holistic whole person approach. And that's kind of what it looks like. We have a lot of other programs as well, and it could go one way or the other. So that's one way it can go. It can also start at that inpatient and then go all the way down, where you step down from inpatient to residential to outpatient to individual therapy to aftercare services. We also have prevention programs, and we can get into the details about all of that. I know that I just kind of spoke a lot, and that's the general spiel I usually give to people, but it's my favorite way to introduce Tarzana Treatment Centers.
Okay. And is it for all ages, so youth and adults?
It is for youth and adults. We treat from, depending on the actual service, we can start from age 5 and then just go all the way up.
Okay. Well, that's awesome. That's awesome. That's why I love what I do, right? I love being in the community and talking to people and letting them know about what we do at Tarzana. So what about like homeless? If somebody comes in homeless, can they still get the help that they need?
Absolutely. We don't turn anyone away. We offer medical enrollment services. We do take walk-ins. Like I said, we do not turn anyone away. We have people there to help, and we have a plethora of different services.
Okay, awesome. What about MAT services? Like, do you have services, medication services for youth or adults that are battling addiction?
We have it for youth and adults, and for those that don't know what MAT stands for, it's medication for addiction treatment. And that means that they can actually start to detox at the outpatient level.
Okay.
So they may not necessarily be at the level where they have to be inpatient and monitored at all times. There's certain medications that you can take daily, weekly, or monthly. It all depends. I'm not the medical professional, but there will be a medical professional that the individuals meet with, and they will take the medication, and they'll also be part of the program. Well, they'll have to go meet with a counselor to make sure that everything is monitored and their usage and everything is being monitored, and we want to make sure that people are detoxing in a healthy and medically safe manner.
Okay. So in our last segment, we were talking about foster youth. And we know that there's a terrible thing that goes on sometimes, not all the time, but there's a terrible thing that happens, sometimes they age out of the programs, out of the foster system. So they turn 18, and then a lot of their foster parents might even want to deal. What would be your message for them? Like, how can we help them?
That's a great question. So we have, like I said, we have a ton of different services for the youth, and at Tarzana, you don't age out.
Right.
You don't. We have services for everybody. So they can, the ideal thing would be that a foster parent would enroll their foster youth into services while they're youth for the preventative services, because there we have the parenting classes, they're there for a few hours at a time, they get lunch, and they start to learn the different coping skills that they need in order to be able to cope and deal with whatever challenges life is going to throw at them, especially with the trauma that comes with having to be in the system. There's a lot of childhood trauma that, unfortunately they will have to work through. So it's great to be in those preventative services, because unfortunately from trauma, sometimes addiction may come along. And once they're in that system, we also have our adult services. So from there, they can go into our outpatient services. And we also have aftercare services. So if they were to go through our entire program, excuse me, we do have aftercare services and different counselors that they'll continue to meet with. We do not just discharge people. And, us being community liaisons, we're out there every single day making those connections with the community. So we have a tons of other resources for them to connect to as well.
Right. One thing I wanted to tap into is our youth residential. I love it. It's not just counseling and therapy, but they also have educators come in and teach them about, what drugs does to their body, how it affects their mental. You know what I mean? And I think it's awesome. I've seen them in action one time, and I thought it was amazing what they do and the impact that they make with the youth and the relationship that they have with the staff. Just, they're like second moms, going in there. And then that's awesome because, our youth really need that, especially in those situations. They really need a support system and somebody that they know that they can talk to. So, I'm grateful for the services. We haven't needed them in our family or anything, but I am always quick to refer because I always see, I've even worked with a young lady, an outpatient, and we went to an event that was for the TAY, which is the youth, transitional youth. And it was such a huge turnout, and I was so surprised because I've never seen, when I was in the system, I didn't see anything like that. But they were there, and the young man came to our table, and he yelled the lady's name and hugged her, and was just like, oh my gosh, and she said, he used to be one of our troublemakers, but he's like, oh, but I keep my notebook, that they told them to keep. Kept my notebook, and when I'm feeling down, I read about all my goals that I've written down, and it was encouraging to see them and what they were doing for them at the program, and what they do at Tarzana. Like, you never know the lasting impression you leave on the youth until you see them after the fact.
Right.
So it was really good. She saw, I want to say 4 or 5 of them. They all called her by her name, and
I love that.
It was awesome. It was awesome.
That's one of the most rewarding parts of the job, being out in the community and being able to speak to the alumni of Tarzana Treatment Centers, especially because we've been around for over 50 years now. So I'll go out into the community and I'm tabling. So I have my resource table, and people will come up and they'll be like, Tarzana Treatment Centers, I graduated from there. I have my kids back now because of you guys. So in Long Beach, we have a women and children program, but it's also for men and children or individuals with children up until school age. And we actually help reintegrate families as well. So we allow the DCFS social workers to come in. The men and women and individuals with children can come in with their children up until school age and be in treatment with their children, because we don't want childcare to be a barrier. And we're all about that family reintegration and the whole system. At our outpatient, we have, we're able to do labs for DCFS as well. And we've even had patients that come in pregnant, they have their child, and they go back into treatment with their child. Nice. So I've spoken to a lot of alumni in Long Beach that have told me that they've had a really great experience because of that program, and that's been one of the most rewarding parts for me.
Oh, awesome.
So especially when I go to like events at the YMCA, and they'll come up to me and tell me that.
So what's the age for women and children or men with children?
Up until age 5. Okay. So unfortunately, it's school age, because at age 5, they have to start going to school, and due to transportation, it gets a little tricky. However, once the parents discharge, they will step down to our outpatient, and they can still bring their child to outpatient. We do have a children's room there. So the 5-year-old has toys there, and there's a window looking into the children's room, so the parents can be in their outpatient group looking into the children's room and watching over their child.
Okay, yeah, that's awesome. When I first got to Tarzana, I saw a jungle gym, and I said, what is this doing here? But when I learned about the service, I was like, that is so amazing. And it's man, those years are so critical, especially with bonding and knowing your parent. Something happens and the kid's about 5 or 6, and they're gonna remember, right? But when they're so small like that, they need that time with their mom or with their parent, and just to feel loved, and what I always say, with somebody that looks like you, right? Yeah, it's important.
It's so important.
It's important. Okay, so let's talk about the school. So with the children that are in school, do we offer services for them?
We do. We actually have a new program that's integrated into a certain school district right now, but also at our outpatient for youth in the Valley, it's after school. Okay. So we want to make sure that kids are able to do their school time and then also focus on their behavioral health needs. So they can come to do all of their behavioral health programming after school. We also have parenting classes, and it's all flexible. So we really try to work with everybody's schedule. They'll even have certain things on the weekends as well. Okay. So they're evening times. And so if you go visit our site, like if you were to want a tour during the day, it's going to be pretty empty because the kids are in school. But come 3-4 o'clock, it gets pretty busy.
I'm sure. So what do you think is a solution for the foster parents in helping their youth transitioning out of the foster care system? Like, what would be some pointers you could give them?
Absolutely tap into those resources. I know that you spoke a little bit on that on our first segment,
Right.
but that is the most important part. That early intervention, just getting those resources and making sure that the support systems are in place, those coping skills, they have their coping skills toolbox ready to go. So whether it be signing up with Tarzana Treatment Centers or just speaking to us and finding out about what other resources we have, what other connections we might have to share. That's definitely what you have to do. Just reaching out to your community because the resources are out there, and if you don't ask, you'll never know. If you don't look for it, you'll never know.
Right.
My dad's favorite saying is, "A closed mouth doesn't get fed." So ask.
Yeah.
It's okay to ask. It's okay to ask for help. No one knows everything.
Right.
Your foster parents, they're not professionals. Parents are not professionals. If your youth is struggling, you might have never had a child struggling before. You're not the mental health professional. There's a
Right.
reason why people go to school for things like
Right.
this.
Absolutely.
And that's what the professionals are there for. And just ask. It's okay to ask.
Yeah. Okay, so transitioning out of the system at 18 or 21 without adequate support can lead to all kinds of challenges like housing, employment, and or access to education. What are some resources that we can help with?
That's a great question. So at Tarzana, they will be assigned with case managers and therapists that will have a plethora of resources to provide to them, as well as I think it's important to hold on to your system of support
Right.
and know who those people are. So whether it be your therapist, your case manager, your DCFS social worker, your CASA, all of those people have resources for you. So whether it be housing navigation, there's different programs out there that are nonprofits that
Right.
do provide funding for youth that are aging out. They will pay for part of their rent, if not all of their rent. They will pay for education. There is funding out there, and it's important now more than ever to reach out to those people that know how to navigate those systems, because they unfortunately can be complicated systems to navigate. But like I said earlier, we're trained to
Right.
be able to do that. We went to school to be able to do that. We want to help, and we're here to help. We'll help even if we're not asked, but sometimes it doesn't help to ask.
Okay, I wanted to give a shout out to Safe Place for Youth. It's a place in LA that helps youth, transitional youth, find housing, shelters. They even have a program. I think I want to say it's called Roots to Grow, where if you have a child, right, boyfriend and girlfriend, or husband and wife and their child, and they have apartments, and then it's monitored by the program. And it impacted me. I didn't know that there was a such thing. But when I saw, to hear it is one thing, but to go and see it is totally different, because it looks just like a regular apartment, right? The kids are playing on the playground. People are coming in with their groceries, coming off of work, and you wouldn't think that it was a placement. But they have awesome programs. So, for those who have any questions, leave a comment at the bottom and ask us some questions so we can answer you and be a help and of assistance.
Yeah, absolutely. And I think that if anyone is looking for specific resources, definitely just leave those comments and we'll go in and just drop the names there. Every day we're out there and we're making connections.
Right. Well, thank you so much for viewing with us today. I hope you enjoyed everything that you heard. I hope that you can really take the time out to get the help. Reach out to us. This feed on for comments. Ask us questions. Let's make this interactive. And I really thank you so much for meeting with us today. It was a joy. It went well. I think. And I'm excited to hear your questions. Thank you so much for watching.
brought to you by Tarzana Treatment Centers. You can visit our website at www.tarzanatc.org or call 1-800-996-1051.